In Module 6, I will be talking about commercial insurances. Some of the topics that will be covered are self-pay, commercial insurances, PPO versus HMO, Medicare, admissions process for commercial insurance patients, treatment protocols, and I will also talk a little bit about direct access patients. So I want to start with self-pay just because it's the most simple one. These patients do not have insurance and they are charged for physical therapy evaluation and for each session that they attend. Patients can also be given the option of paying all sessions ahead of time. For example, let's say you tell the patient you can pay 6 sessions ahead of time and I will give you a discount. And always make sure that they understand the price is usually $100 per visit. Commercial insurances. So some examples of commercial insurances, which are private health insurances, are Cigna, Blue Cross Blue Shield, Aetna, United Health. There's a million of them, but just to give you an idea of what a commercial insurance is. For these patients, insurance card info must be collected with ID, and benefits need to be verified. So sometimes patients will call you and they will tell you that they already verified their insurance, that they know exactly what their copayment is. The protocol is that you always check. So it does not matter if the patient already checked their benefits. Protocol is that you always collect their information and you check their benefits yourself. So PPO versus HMO. These are types of health insurances. PPO is out of network and no contract is needed, which means that the patient can go to any doctor or specialist and no contract is needed with the insurance company. So they're pretty much free to see whatever doctor they want. Doesn't matter if the provider is in network or out of network with that insurance. Usually these premiums are more expensive, but the insurances usually pay more to the providers. So HMO has to be in network, so that means a contract is needed. And it's very hard. It means they could only go to specific providers that the insurance is contracted with. But usually HMOs have less expensive premiums, so usually most people have HMOs because the rates are contracted between the therapist and insurance companies. These insurance contracts pay much less for services provided. But why use HMOs? Why not use PPOs? And the reason why is because, like I said, most people have HMO, so you will be seeing a lot more HMO patients than PPO. And also, when you are in network with an insurance, you're listed as a provider on their website. So that means that you would get more patients. So when the patient is looking for a specific provider, your name will come out in their list of in-network providers. You have the best of both worlds. You can build in and out of network benefits. Remember in the previous modules when I was talking about 2 facilities that you will have in your schedule for billing? One will be the PT Now with the company name with your location's name, and then the other one will be PT Now Holdings. So you can build out of network through your company, and you can build in network through the PT Now Holdings company. You could always choose to contract with any insurance company and be in network with your company, but you will lose the out-of-network benefits. So what we do is whatever insurances we are in network with, all we have to do is add your location to it. And you can bill through the PT Now Holdings company. Now you can go out of your way and do your own contracts with insurances so that you can make an in-network bill in network with those insurances, but you will lose the out-of-network benefits. So PT Now Holdings is just a pass-through company. We make $0 off of this. We will send 93% back to your company and 7% for billing. So Medicare patients. Medicare is a government insurance for beneficiaries over the age of 65. You always need a referral from a medical doctor if you see a Medicare patient. And you have to keep in mind that there is a Medicare cap of how much you can bill, which is right now for this year is $1,980 for PT and OT combined. If patient needs more, it has to be medically necessary and you need to add the KX modifier setting in Thera office. If the day comes that you do have a Medicare patient and the patient needs more therapy, make sure you do add that KX modifier setting in Thera office. And you can call Thera office and they will teach you how to do that. So functional reporting for Medicare patients. All Medicare patients that come into your office must have a functional reporting in their notes, in their file. And how we do this is that we collect our G codes through a questionnaire. We usually get these questionnaires on a website called orthopedicscores.com, and you would choose the questionnaire based on the body part that is injured. So let's pretend it's a knee. If the patient comes in with a knee, you would go into the orthopedicscores.com and choose the questionnaire that is meant for the knee. And all the questions will be based off of that body part. And it must be completed by the patient on the first visit and every 10 visits after that with the updated progress note. So the patient will come in, fill it out the first time. After 10 visits, you have to give that patient the same questionnaire again, and the therapist has to input those scores into the patient's file. If the therapist does not do that, after the 10 visits, the system will automatically not allow notes to be completed or locked until that functional reporting is complete. So the admissions process for commercial insurances, you need the patient's name, insurance name, and member ID and date of birth. You need to always verify insurance benefits, schedule appointment for the evaluation, have patient fill out the intake form. During their intake process, you make copies of their ID, their insurance card, make copies of their prescriptions, and if they have any other medical records, collect co-payment if they have one. Always schedule for recurring appointments on the first visit for all patients. And remember, you can always set up important reminders in the patient's file, which you will learn when you watch the TheraOffice videos. There's a section where you can put important reminders. So for example, maybe you can put a reminder on when the patient is supposed to follow up with their doctor again. Or maybe you can put a reminder on how many visits the patient is allowed. So that way you keep track of the patient and what they're supposed to do. So treatment protocols. Remember the 4-step process that I taught in the first module. Always evaluate, treat, progress notes, and discharge. Patient is to follow instructions given by referring physician, but also by the PT. So if the PT believes that maybe the patient needs to go back to see the referring physician because they're not getting any better, then they would have to follow those orders. After order and prescription is completed, patient should follow up with his or her referring physician if pain or discomfort persists, and discharge when applicable, ordered by referring physician or PT. So like I said, if the patient is not feeling any better, is not getting better, then the patient should go back and see the referring physician, because maybe the doctor might recommend for her to do an MRI or to see a specialist, things like that. And the last one is the direct access patient. Now, direct access, a lot of people get confused. They think that direct access is an insurance. It's not an insurance. It's just a type of patient. A direct access patient is a patient that can be evaluated by a physical therapist without a physician referral and treat for 30 days, not 30 visits from the first day of service. So it's a patient who might have some type of pain. Maybe they were working out at the gym. Maybe they have this chronic back pain from work. And they just want to get some therapy. They can come into to your office and not need a referral, and they can treat for 30 days without the referral from the first day of service. After those 30 days, then they would either need a referral, or you can also get their evaluation that was done from the PT on the first visit, and give it to either their primary doctor, or you can give it to a doctor. If the doctor signs it, that's automatically that's basically like giving them already a automatic referral to continue treatment. Now there's different provisions for different states. I put the one here for Florida. They're all pretty similar, but they all have a little bit different things here and there. But the main things you do want to look for in direct access patients, you want to make sure that the patient can be treated by a physical therapist. Now, obviously, if you're on the phone with a patient, you can't really tell, but you can ask certain questions. I've had patients call and they tell me that their leg is completely swollen, it's black and blue. I mean, I would not recommend therapy for a patient that has a completely swollen leg. I would recommend for them to go see a doctor first. But if it's a patient that maybe he was just working out and was doing pull-ups and he's a little bit sore, or he's been having chronic back pains, or he just doesn't feel good because he went running, then you can have them come in, be evaluated by the therapist, and the therapist will decide whether or not they can treat the patient without the referral from a doctor if they feel comfortable, if it's still inside their scope of, of being a PT. And also if the patient was just out of surgery or had surgery not too long ago, then for that you do need a referral from an MD. You cannot see the patient as a direct access. You have to get a referral. And that's the end of module 6.